Checking your risk of prostate cancer. Having a prostate check is your decision. It won't tell you if you have prostate cancer. The check assesses your risk of having it. The check will tell you how likely you are to have it. Checks usually involve a blood test called a prostate-specific antigen test, or PSA, and a digital rectal examination, a DRE. The prostate-specific antigen, PSA, blood test. This is a blood test to measure the PSA level in your blood. The prostate gland makes PSA. The blood test is free, but your doctor's usual charge may apply. Higher than normal levels of PSA can be caused by an infection of the prostate gland, by an enlarged prostate, which is not cancerous, or by prostate cancer. Most men with a higher than normal PSA level won't have prostate cancer. However, your overall risk of having prostate cancer is higher if you have a higher level of PSA than normal. The higher the level of PSA, the more likely it is to be a sign of cancer. Overall, there is an up to 1 in 4 chance that you may have prostate cancer if your PSA levels are higher than normal. Sometimes men with prostate cancer will have normal PSA levels. Digital rectal examination, DRE. This is a quick way for your doctor to check whether there may be a problem with your prostate. To feel the surface of your prostate, the doctor will place a gloved finger into your rectum. You're more likely to have prostate cancer if your prostate feels rough, hard, or irregular. A DRE may not find very small cancers. Depending on your age and your PSA level, your doctor may recommend regular screening or further tests, or may refer you to a specialist. Should I have a blood test to check for prostate cancer? Having a prostate check is your decision. Choosing whether to have a prostate check or not is an important decision to make. A prostate check aims to reduce your chances of being harmed or dying from prostate cancer. While the PSA blood test and the DRE may be uncomfortable, there is no risk from having them. They do not harm you in any way. Depending on your PSA and DRE results, you may need to make decisions about more tests and possibly treatments. The tests and treatments have benefits and risks. They can cause harm. You need to understand what the benefits and risks are so you can make the right decision for you and your family and whānau. Things to think about when deciding about a prostate check. A check can reduce your risk of dying from prostate cancer because the cancer can usually be cured if it is found early. The older you are when you have prostate cancer, the less likely you are to die from it. Many men die with prostate cancer, but not because of it. If you are not checked and do have prostate cancer that spreads, you may suffer pain in your bones, develop kidney failure and liver problems, and die from the disease. Sometimes doctors can't tell which prostate cancers will grow quickly and spread. So some men found to have cancer may have further tests and treatments they don't need because their cancer was never life-threatening. Active surveillance, as per page 17, will reduce this risk. Prostate checklist for men. If you answer yes to any of the following, talk to your doctor, nurse or health professional. When deciding about a prostate check, you may want to talk to your family and whānau and a trusted health professional. The checklist questions are you peeing more often? When you pee, do you have trouble getting started or stopping? Do you have poor urine flow or dribbling? Do you often get up at night to pee? Do you ever have blood in your urine? Or pain in your lower back, hips, or ribs? If you have answered yes to any of these points, it may not mean you have cancer, but you should get them checked by your doctor, nurse, or health professional straight away. Do you have a family history of prostate cancer and are 40 years old or more? Are you 50 to 70 years old? Are you concerned and want to know more?